Think about the last television or the last car that you bought. How would you feel if you wanted the car that had the most horsepower, the best acceleration, but when you talked to that salesman, he kept pushing the cornering ability or the radio or the Bluetooth inside the car? Every time you asked about the car and the features that were important to you, he replied back with how great the Bluetooth connectivity was and the leather seats inside. You would soon get kind of disenchanted, frustrated, possibly even walking away without buying. Now, for the next 2 days, I want to tell you how you and many other dentists are making this same mistake right now with your patients. Stay tuned. Colin, Receiver here, and I hope you've been enjoying this series, this month-long series on common dental marketing mistakes. Today, I want to talk about delivering the wrong message. It's such a problem that I'm going to take 2 days to talk through it. Now, first, let's start with one of the most insidious problems I see in all of marketing. It's one word. It's called branding. Now, branding might work for big corporations who have hundreds of millions of dollars to throw around and invest in how people feel about their company. But for dentists, for small business, branding is a byproduct of the value, how people feel after they become your patient. The problem is that so many so-called experts don't understand that dentistry is not Disney, it's not Coca-Cola, it's not a dishwasher detergent. Many of those experts aren't really even experts. They're graphics designers who know how to make an attractive ad or a website or make something look pretty. And when you push brand, there's no accountability for ROI. After all, how do you measure the return on someone's feelings about your practice? I'm not saying you shouldn't worry about someone's feelings. I'm saying focus on the results that matter. With dentistry, the most effective message is to address your patient's perceived problems and then show how you're the answer. Now, notice I said perceived problems because what you perceive their problems to be and what they perceive their problems to be are going to be two very different problems. Listen to what they're saying. If they say, I hate my dentures, I'm embarrassed to smile, I can't eat the foods I love, or whatever patients are looking for a dentist, especially in your big case procedures, that's the problem they have. The reality is your patients don't care about you. They might like you, but they don't care about helping you meet your financial or patient goals for the month. They care about themselves. It's very selfish. And more importantly, they care about the solution to their problem. So if all you talk about is we do this and we do that, your patients are walking out. You have to talk in terms of you, what you can do for the patient. Not that you do implants and crowns and fillings. You give people confidence, allow them to chew and eat the foods they love, allow them to smile with confidence. I like to say that doctors who make this mistake have a big we problem because they're always talking about we this and we that. Getting away from thinking about this will help you attract more and better patients into your practice. It's a major marketing message problem that's easily fixed. Now, I addressed this earlier, but it can't be overstated. Prospects don't care about your training, your equipment, your buffet menu of procedures that's on your website, or anything else that would matter to you as a dentist. The majority of dental marketing that I see is more attuned to attracting other dentists than it is to attracting patients. Patients care about whether they trust you and whether they trust that you can solve their problems. And we're going to talk more about this tomorrow. So until then, keep moving forward.